Other conditions and products. Dry mouth. Xerostomia is a condition that causes a lack of saliva in the mouth, resulting in dry mouth. This can cause oral disease and discomfort. Saliva is necessary to maintain the health of the teeth and gums. It protects, lubricates, and cleanses the mouth, and aids in disease resistance. Decreased saliva flow can be caused by medications, illness, chronic diseases such as diabetes and hypothyroidism, or from cancer therapy. Residents with a dry mouth may find that their tongue sticks to their palate, and they may have trouble speaking, chewing food, or swallowing. They will be thirsty and will probably lick their lips frequently and complain of a burning or sore mouth. Having a dry mouth can cause plaque and tartar to accumulate in the mouth. This increases the risk of dental decay, particularly along the gum line. Some residents will complain that their dentures hurt or do not fit properly. Residents with dry mouth can even stop eating because of discomfort when chewing or trying to swallow food. They may need large amounts of water to help moisten the food and move it down their throat. There are many ways to help residents with dry mouth, such as placing a humidifier in their room, using toothpaste and rinses designed to treat dry mouth, and using saliva substitutes and lip lubricants. Saliva substitutes are products that contain physical and chemical properties similar to natural saliva. These saliva substitutes can be applied throughout the entire mouth as often as needed for comfort. Saliva substitutes provide long-lasting lubrication that soothes and helps relieve dry mouth. They can help reduce burning and minor irritations and help with swallowing. Most saliva substitutes are naturally sweetened with xylitol. Some examples of commercial products are Oral Balance, Bio Extra, Xerostome, Moisture, Mouth Coat, OptiMoist, and Xerolube. Lip lubricants contain lipid hydrophobic bases that help prevent moisture loss and softens the skin. Dry lips can be painful and embarrassing. Lips can become dry and cracked, especially in residents that have xerostoma. Dry, cracked lips are also common in residents who are dehydrated, are on multiple medications, or have nutritional deficiencies. It is important to keep the lips moist to allow comfort when eating and communicating. Apply lip lubricants generally, as often as needed to the lip area. Fluoride products. Fluoride products are used to prevent dental decay. They are indicated for people with natural teeth who have a history of dental decay, a high number of fillings, and/or a dry mouth. Although fluoride products are becoming more common when caring for older adults, they are typically prescribed or recommended by a dental professional or primary health care provider. The frequency of applying these products varies depending on the situation. Fluoride varnish is painted onto the teeth. If used properly, it is safe, cost-effective, and easy to apply. It takes less than 2 minutes to apply and adheres to the teeth even in the presence of saliva. Fluoride is slowly released over time to help remineralize the tooth surfaces. Residents should not eat or drink for approximately 30 minutes following the application of varnish and should wait until the next day to brush. Fluoride gels and fluoride rinses are available at the pharmacy over the counter. They are also used as a medication to prevent tooth decay and strengthen tooth enamel. These products should be used as directed or prescribed by a dental professional. Fluoride should be used immediately after brushing and flossing and just before bedtime. It is important not to eat, drink, or rinse for 30 minutes after using a topical fluoride. This allows the fluoride to adhere to the teeth. Any residue left in the mouth after fluoride rinsing or application should be spit out or expectorated. When residents are unable to spit effectively, fluoride must be used with caution. Cold sores. Cold sores are very common for many people and are characterized by small red blisters on the lips. The herpes simplex type 1 virus causes cold sores. This virus is very common and highly contagious. After the initial outbreak, these blisters can occur frequently and there is no cure. There are many over-the-counter treatments available. Common over-the-counter medications are Abreva and Silactin. These products should contain docosahexaenol or benzyl alcohol and are available in gels or creams. For the best results, use these products as soon as there is a tingling sensation on the lips. This usually indicates a cold sore is starting to develop. Directions for use. Wash your hands and the resident's hands, lips, and face with soap and water and dry with a clean towel. Apply the cold sore treatment directly to the cold sore with a cotton swab. Discourage the resident from licking their lips. Reapply as necessary up to 5 times per day. Symptoms can last up to 14 days. If a cold sore lasts more than 14 days, a physician or dentist should be consulted to prescribe antiviral medication. Beware of any eye irritations. This virus may spread to the eyes and is one of the primary causes of blindness. Canker sores. Canker sores are a type of herpetic lesion. They are also known as aphthous ulcers and are the most common type of mouth ulcer. Canker sores are painful and highly contagious. They can be passed on from one person to another via kissing. They tend to heal on their own within 14 days. If a canker sore lasts longer than 14 days, or if the resident has a fever, a physician or dentist should be consulted. These small painful sores are caused by a variety of factors, including injury to the mouth, stress, unhealthy diet, and medical conditions. Some medications, as well as nicotine gum, can cause mouth sores. Switching to nicotine spray or patches can eliminate this issue. It is important to avoid acidic foods when a canker sore is present. Treatment of canker sores depends on the type of canker sore and severity. It is important to try to determine what triggered the outbreak, as prevention is often the best treatment. There are no known cures, but there are different remedies and medications to help relieve the symptoms associated with canker sores. Remedies include saltwater rinses. Mix 1 teaspoon salt to 1 cup of warm water. Swish the solution around the mouth as you would a mouth rinse and spit out. Half a teaspoon of baking soda mixed with water until it makes a thick paste. Use this paste to cover the canker sore. Hydrogen peroxide can be mixed 1:1 with water. This solution can be applied to the canker sore using a cotton swab. Milk of magnesia can aid in the healing process and reduce pain associated with canker sores. Apply it directly to the sore 3 to 4 times a day. There are many over-the-counter oral care products available to help relieve the symptoms of canker sores and speed up the healing process. These products include gels, pastes, and rinses. Use these products as directed. In severe cases, oral medications can be prescribed by a dentist or physician. Mouth props are a valuable tool when working with a resident who is resistant to oral care. Mouth props can assist care providers in opening a resident's mouth and in keeping the resident's mouth open while they complete the resident's mouth care. Residents can gently bite on the white spongy mouth prop to help relax the muscles of the jaw while oral care is being done. It is sometimes hard to get the mouth prop into the mouth if the resident is clenching and resisting care. Because the prop is soft, it can be wedged in between the front teeth in the flat position and then turned to assist with opening. The prop should rest between the back teeth and not on the front teeth. The teeth should be positioned on the ridges. When the prop is resting on the left side of the mouth, care can be performed on the right side of the mouth, and vice versa. Care providers can also dip the prop in applesauce or jelly to help with inserting. The handle of another toothbrush can be used in place of a mouth prop if one is not available. This is called the two-toothbrush technique. Tongue cleaners. The tongue is often overlooked when brushing. However, the tongue and cheek tissues can accumulate bacteria on the surface. Both the tongue and the cheeks should be brushed during daily oral care. Commercial tongue cleaners are also available. Depending on the cleaner, there is often a plastic edge used to scrape buildup and debris off the tongue. Sometimes there is also an edge with bristles to brush the inside of the cheeks and the top of the tongue. Some toothbrushes now have tongue cleaners on the opposite side of the toothbrush head.